Good day, Dr. Chan. Today, our group will be presenting the case study of prophylactic knee brace based on the aspects of statics and mechanics. My name is Kao Hong-jun, matrix number 23005107.
My name is Wei Ming, matrix number 23005158.
Hi, my name is Jordan Tawan Chong, metric number 23005084. Today, I'm going to discuss about the moment of inertia.
I'm Ding Yabo. Today I will introduce you to knee brace. First, what is knee brace? The knee brace is one of the orthoses applied external to part of the human body. An orthosis is a medical device used to modify the structural or functional characteristics of the neuromusculoskeletal system to maintain, improve, and recover lung function. Knee braces have been proven to provide support to post-operative knees and prevent knee injuries. It consists of four main types: prophylactic knee brace, functional knee brace, unloader knee brace, and rehabilitative knee brace. The prophylactic knee brace is chosen as a medical device for this case study. It is often worn by the elderly and athletes who participate in high-risk sports, such as football, to reduce exposure to injuries. The main mechanism of action that exists for prophylactic knee braces is known as mechanical support. Mechanical support can be classified into two, which are unilateral support and lateral support. A unilateral support brace has medial or lateral upright stay, which can be single-axis, dual-axis, or polycentric, while a bilateral support brace has a stay on the medial and lateral side, which can be bilateral or polycentric. Based on our research, the main function of knee braces include protection and injury prevention, pain management, stability and alignment, reduction of load and pressure, postoperative rehabilitation.
So our group has selected knee pain as our targeted injury to carry out our background study. So here's what we got from the background studies. Knee pain has always been a common chronic problem faced especially by the athletes and elderlies. The problem usually arises due to the overuse of muscles and overstressing the knee itself. Athletes who participate in sports which are jumping heavy like basketball, volleyball, and long jumps have the highest odds of having knee pain. Their knee will be used heavily from time to time to transfer jumping forces from the tip of their toe to the body or to absorb shock while they are landing after jumping. Research shows that our knee will have to withstand around 20 times our body weight. Thus, different components in the knee might suffer, swell, and even inflame due to overusing and overstretching of it. Common knee injuries which results in knee pain includes knee bursitis, patellar tendonitis, iliotibial band syndrome, and meniscal injury. As for the elderly, due to aging and senescence of the muscles, tendons, and connective tissues like cartilage on the kneecap and synovial fluids, it causes the elderly to suffer from osteoarthritis, which is a form of arthritis that occurs when the cartilage in the knee joint breaks down, causing the bones to rub together. Knee pain is often underreported, underestimated, and undertreated, as most of the normal citizens think that it is normal to have knee pain and it will recover in a few days. But little did they know that appropriate corrective actions should be done to curb knee pain from the root of the problem. So there are around 654.1 million individuals 40 years and older with knee osteoarthritis in 2020 worldwide. The pooled global incidence of knee osteoarthritis was 203 per 10,000 person years in individuals aged 20 and over. Correspondingly, there are around 86.7 million individuals 20 years and older with incident knee osteoarthritis in 2020 worldwide. The prevalence and incidence vary substantially between individual countries and increase with age. The ratios of prevalence and incidence in females and males were 1 to 69 and 1 to 39 respectively. These studies demonstrated the urgent need to research fresh approaches to treating chronic knee pain not only among athletes but also among civilians. There are various ways could be done by everyone to reduce and prevent knee pain on the first hand. These includes maintaining a healthy weight, having an appropriate posture while standing or sitting, and exercise regularly. While for athletes, sufficient relaxation of muscles around the knee and rest are vital to keep the knee healthy and wear necessary protective equipment to protect and stabilize the knee as it reduces stresses applied to the knee itself. This is where prophylactic knee support (PKB) or targeted biomedical device comes in handy to protect the knee from injury or aid in rehabilitating the knee of patients who suffers from knee injuries.
The objective of this case study includes to describe the 5 learning outcomes based on the prophylactic knee brace, to perform equilibrium-based analysis for various structures by using the free body diagram method, to solve problems involving the body under the action of axial, bending, and torsion load. The fourth objective is to employ moment and inertia-based analysis for problem solving due to compound load, while the fifth objective is to evaluate stress and deformation of biomedical devices. Lastly, to perform effectively as a team in analyzing real-life cases of static objects under loading. While carrying out our study, several steps are taken. First of all, we choose prophylactic knee brace as a real-life example in this case study. Pictures of the knee brace were taken. All the dimensions include the height, the width, the thickness, and the diameter of the patellar opening were measured using a measuring tape. To analyze the knee brace while we are running, the circumference of the knee is measured to obtain its radius. Distance between the upper strap and the lower strap with the center of the knee are measured. Eventually, questions related to the 5 learning outcomes are developed. With respect to the first learning outcome, we draw a free body diagram of the knee brace and the knee. We assume that the force exerted by the main joint, which is the femoral patellar joint at the knee, is 5 times our body weight while we are running. We then calculate the equilibrium force on the knee brace while we are running. Next, for the second learning outcome, we calculate the stress due to the bending at the cross-section of the knee brace. We also calculate the maximum shear stress acting on the knee brace due to the torsion of the knee brace while we are fastening up the straps to tighten the knee brace at our knee. For the third learning outcome, the total moment of inertia around the x-axis and the y-axis at the location of the centroid is calculated. We divide the knee brace into two parts. For the fourth learning outcomes, we calculate the stress and deformation of the knee brace. While, last but not least, for the last learning outcome, every group members work together to work on the research of real prophylactic knee brace and obtains the measurement of its dimensions. Moving on, tasks were divided among group members. At last, a video explaining the statics and mechanics of prophylactic knee brace is created. While carrying out our case study, several assumptions are made. First of all, the first assumption made is the prophylactic knee brace is assumed to be in new condition without undergoing any damage in its structure. The second assumption made is all the forces acting on the knee brace are in equilibrium. While the third assumption is systemic errors need to be ignored during the measurement of the dimension of the prophylactic knee brace. While at last, we also assume that only the upper and lower straps of the knee brace exerts significant compressive force on our knee, while the other part are negligible. Moving on to the result of our case study, we are against insights on the knee brace based from several aspects. Before performing equilibrium-based analysis, a free body diagram is drawn to showcase different forces acting on the knee brace and acted by the knee brace. According to our research, the force exerted by the main joint of the knee, which is the femoral pedal joint, is 5 times our body weight while we are running. Hence, if a person has a weight of 70 kg, which is equivalent to 700 Newton, his femoral patellar joint will exert a force of 3,500 Newton. We also found that the average knee flexion angle while we are running is about 40 degrees. From our measurement, we also obtained that the distance between the straps to the center of the knee is 6.5 cm. We assume that the alpha angle and the beta angle is 30 degrees during our calculation. Using the trigonometry rule, we can obtain the vertical length of AC, which is equal to 12.216 cm. For objects in static, the total moment and the total forces is equal to 0. By performing calculation, we obtain the force exerted by the upper part and the lower part of the knee brace is almost similar, which is equal to 2020.75 Newton. In order to understand the bending across on the knee brace, we first have to calculate the moment of inertia with respect to the centroidal axis of the cross-section of the knee brace, which gives us a value of 1041.667 mm power 4. The couple act on the cross-section of the knee brace is calculated using the following formula, which is the force exerted by the upper part of the knee brace times the distance from the center of the upper straps to the uppermost part of the knee brace. Gives us a value of 121.245 Nm. Using the flexural formula, we obtain that the maximum compressive stress is negative 291.42 megapascal, while the maximum tensile stress is 291.42 megapascal.
Or for the part of torsional load to be experienced by the leg and knee exerted from the strap of knee brace to fix the knee brace into position and limit the activity of knee to stabilize it during the activity of our body. In order to calculate the maximum torsional load, we assume that T equals to 500 Newton meter and we had measured the circumference of knee to be 28.5 cm. Then by using the formula C equals 2 pi radius, we get the radius of knee, which is 0.04539 meter. Next, to calculate J, we apply the formula of J equals half of pi times C to the power of 4, and we will get J equals to 6.6675 times 10 to the power of negative 6. Lastly, we are able to find the maximum shearing stress, tau max, by using the formula TC divided by J, which equals to 3.4038 megapascals. So that's all for torsional load part.
Firstly, let's evaluate the moment of inertia with respect to the x-axis. For the rectangle, Ix equals to 1/12 base times height cube. Plug in the values and you'll get the Ix equals to 6.667 times 10 to the power of negative 5 meter to the power of 4. For the circle, it's 1/4 pi r to the power of 4, and you'll get a value of 1.0235 times 10 to the power of negative 7 meter to the power of 4. Punching the numbers, we find the total moment of inertia by subtracting Ix of the circle from the Ix of the rectangle, and the results will be 6.6568 times 10 to the power of negative 5 meter to the power of 4. Moving on to the y-axis, similar calculations awaits us for the moment of inertia for the rectangle and circle. Subtract Iy of the circle from the Iy from the rectangle to get I total, and the result will be 1.6568 times 10 to the power of negative 5 meter to the power of 4. Now, let's find the radius of gyration with respect to the centroidal axis. It's the square root of I total divided by the area. Plug in the numbers and there you have it. Kx equals to 0.0594 meters. Finally, for the radius of gyration with respect to the y-axis, it's another square root calculation. With the number in place, ky turns out to be 0.0296 meters. Now, let's move on to the stress and deformation. According to Pereira at 2007, the main material used to make knee brace is neoprene and its modulus of elasticity is 80 kilopascal. Now, let's determine the areas. For the rectangle, the area equals to length times width, giving us 0.02 square meters. And for the circle, it's pi times the radius square, resulting in 1.134 times 10 to the power of negative 3 square meters. Subtracting the circle's area from the rectangles, we get a total area of 0.018866 square meters. Moving on to stress, calculated by force per area, for our knee brace, the pressure equals to the force of femoral patella joint. By plugging in the numbers, the stress equals to 0.1855 megapascal. Now, let's explore deformation using the formula pressure times length over the area times modulus of elasticity. With the values in place, the result is a deformation of 0.011595 meters. Moving forward to the future work of our knee brace. Beyond prophylactic knee brace, there are additional types of knee brace including functional knee brace, another knee brace, and also rehabilitative knee brace to research. Functional knee brace are designed with the specific purpose of providing support to knees that have sustained injuries, whether from sports activities or falls. Their primary function lies in stabilizing the joint during the recovery process. One of the key benefits of this brace is their effectiveness in reducing rotational movement, particularly advantageous for individuals in the process of recovering from an ACL, injury, or tear. Post-ACL repair surgery, functional knee brace continue to play a crucial role by offering additional support. This assistance is essential in maintaining stability and preventing re-injury during the delicate rehabilitation phase. Unloaded knee braces are specifically designed to provide relief to individuals suffering from medial compartment knee osteoarthritis, addressing the pain and discomfort associated with this particular form of arthritis. The primary function of unloaded knee brace is to unload stress from the affected knee joint. This is achieved by exerting pressure on the tight bone, prompting the knee to bend away from the painful area, thereby minimizing stress on the affected compartment. These braces offer focused and targeted support to arthritis needs, providing a supportive framework that helps individuals manage pain and maintain better mobility during daily activities. Other than that, rehabilitative knee braces are specifically designed to provide crucial support during the post-surgery phase, offering stability and protection to the knee joint as it heals after a recent knee surgery. The primary function of this brace is to restrict potential harmful knee movement during the rehabilitation period. This limitation helps prevent accidental stress on the healing knee and support a more controlled recovery. A rehabilitative knee brace play a key role in the rehabilitation process following knee injuries, aiding in the recovery of torn ligaments, damaged cartilage, or other traumatic knee injuries. Even though there is a lot of literature on the topic, it is crucial to identify and address the challenges faced during the research project to ensure the validity and reliability of the findings. First is an inadequate study of adverse effects. In a presented case study, the knee brace is worn for only a brief period to assess its functionality. However, extended use of knee brace may potentially result in adverse effect for users. Individuals with sensitive skin may experience skin irritation and redness from prolonged use. Moreover, there is a likelihood that wearing knee brace for an extended duration could lead to muscle fatigue due to altered loading dynamics. It is imperative to consider these factors when investigating the long-term implications of knee brace usage. Secondly is the predominant focus on common knee condition. In this case study, our primary focus is on the elderly population experiencing gait disorder and athletes engaged in high-risk sports. However, concentrating solely on extensively studied knee conditions may result in an incomplete understanding of how knee brace perform in more complex scenarios. Additionally, there are individuals with rare conditions who utilize knee brace for alternative purpose. Therefore, future research could encompass a broader scope to address the diverse needs of various patient groups.
In conclusion, we have managed to demonstrate all the learning outcomes in this group assignment, which are analyzing system using free body diagram to perform equilibrium-based analysis for various structures, LO1, solving problems involved in the system under the action of axle, bending and torsional load, LO2, employ movement of inertia-based analysis for problem solving due to compound load, LO3, evaluate stress and deformation of biomedical devices, which is prophylactic knee brace, LO4, and perform effectively as a team in analyzing real-life cases of static objects under loading, LO5. Besides, we gain insights on the working theory of knee and learn how to draw different types of free body diagram for different types of condition we wish to collate. In short, our group gained insights of the application of what we had learned in this course in our daily life via having case study by analyzing the statics and mechanics of prophylactic knee brace PKB. We also acknowledge the usefulness and importance of these orthotics towards people who are suffering from different kind of knee injuries. That's all from our group. Thank you.